Welcome, everyone, to this constellation on alcohol harm reduction 2021 and beyond. And I'm just going to ask if my slides can be shared. I just want to give you a very warm welcome and greeting from, I'm on Vancouver Island, which is the traditional territory of the Coast Salish people. And my name's Bernie Polly, and I'm going to be opening the session with a few comments. And I'm here with many of my good colleagues who work with me together on issues around alcohol harm reduction, and we're all affiliated with the Canadian Institute for Substance Use Research. And we're going to have an opening session where we introduce the idea of alcohol harm reduction, and then we're going to go into 3 breakout sessions. One of them will be with Tim Stockwell, who's going to talk about facilitate a discussion on pricing policies, Megan Brown and Sybil Goulet-Stock, who are going to facilitate a discussion on managed alcohol, and Brittany Graham and Miles Harp, who is with Vandu and Eastside Illicit Drinkers for Education, are going to talk about municipal alcohol harm reduction policies, as well as alcohol harm reduction for illicit alcohol as well. And so I just want to give some kind of opening comments to kind of put this topic into context, because I have very much enjoyed attending the Harm Reduction International events for many years and conferences. And often alcohol and alcohol harm reduction isn't so prominent among the presentations. And often there's the last one I was at was in Portugal, and I think there were less than 4 or 5 sessions that included something about alcohol and alcohol harm reduction. So I just want to open with some comments about alcohol harm reduction. Alcohol has a variety of meanings and is often part of our social fabric, our social culture. It has, a background in terms of being part of celebrations, or it may be, there are certainly religious norms and values in many different countries around the culture of alcohol and the meaning of drinking. And I think also understanding why people drink in terms of the benefits, the relaxation, the pleasure, but also as the responses to things like trauma and stress, which we've, particularly note there's been an attention to alcohol consumption during COVID. And so I think we bring with us to this topic a lot of social mores and cultural values around alcohol and our relationship to alcohol in the part of the world that we live in. The World Health Organization has highlighted, even though alcohol is a legal drug, worldwide 3 million deaths every year result from alcohol. So approximately 5.3% of all deaths. And it's implicated in more than 200 disease and injury conditions. And so, there was a time in North America where there was a prohibition on alcohol, where harms were escalated during that period of time. And so we are in a time and place where we need to think about and focus and say, okay, we have a legal drug. We're not grappling with the harms of prohibition as we are with illicit drugs, but how do we introduce and address issues related to alcohol-related harm as part of health and well-being? I just want to comment, this comes from the WHO work that was done in 2014 by Loring, and it highlighted that alcohol harms are not distributed equitably, but they are impacted by conditions in society. And you see on the screen the socio-ecological model, which was developed comes from Dahlgren and Whitehead back in the 90s, that's still really relevant in terms of the harms produced or can be produced by the conditions in which people live. And, that can relate to a number of things. It can relate to policies, it can relate to drinking cultures, it can relate to housing and income as well. And we often know that there's higher rates of harms where there is greater poverty, even though consumption may not be higher, except in sort of specific cases. So this chart here just really highlights some of the strategies that we think about in terms of alcohol harm reduction. So we're trying to prevent harms, not necessarily preventing use, which is very much key to a harm reduction definition. And we've tried to put together a session where you can have an opportunity to engage with people who are doing work in all of these areas, in research, in practice, people with lived expertise around some of these issues. So one of the macro policy issues, which is usually at a country level, or for us at a state or province level, is around pricing policies and what the minimum unit prices are, pricing by alcohol volume, prices being indexed for inflation. And that's going to be one of the sessions today. At the municipal level, more so, there are municipal alcohol policies around, these would still be at a higher level around the physical availability of alcohol, what hours of operation occur, where, how many outlets, the density kinds of issues, drinking and driving policies. Marketing and advertising is a huge kind of area where, we can look at, for example, some of the work that's been done around women in alcohol and highlighting issues around, certain alcohol products being marketed specifically to women, minimum legal drinking age, and then at a program or more local level, server screening and brief interventions, which, are at the practitioner level, server training and management. Those are just some examples that go from kind of broad level, high level policy through kind of provincial or state or municipal down to kind of organizational policies. We've highlighted that while these alcohol harm reduction strategies are very important, there's also some people that are left out of this. And we've done quite a bit of work, around looking at managed alcohol programs and also reducing harms for people who may have substance use disorders. So our 3 sessions, one is going to be around alcohol policies and reducing harms. And it is through, as someone is pointing out in the chat, and I think Tim will talk to this more in terms of how these act to reduce harms through reducing supply and access. And Tim will talk about that. I think these issues have become particularly, they've been a huge area of work previously about concerns related to cancer, but issues have been highlighted during COVID with concerns, of course, about increasing consumption of alcohol related to social isolation. One of a more local issue, which I think Edge and Brittany and Miles might touch on, is around municipal alcohol policies and in parks. And so the East Side Illicit Drinkers for Education, Brittany and Miles are with that group. It's a group of people who advocate on behalf of people who use illicit alcohol for their health and well-being. And they've done a tremendous amount of work at the municipal level, creating the Vancouver Alcohol Strategy, which you can have a conversation with them about. We've worked together with them in the Canadian Managed Alcohol Program study, creating safer drinking tips during COVID, and they've long been advocating for managed alcohol programs. And there's a commentary that they wrote on the bottom, which describes their position in terms of work and action around safer drinking. And then at the programmatic level, Megan Brown and Sybil Goulet-Stock, they are going to host a session on managed alcohol programs. All of us on this call have been part of the Canadian Managed Alcohol Program study, which has really filled in a gap in sort of addressing potentially unintended consequences of some of these better macroeconomic policies or macro kind of government level policies around alcohol, and has often left people living in very risky situations, particularly if they're outdoors, experiencing homelessness and or poverty. And so they're going to facilitate a discussion about managed alcohol programs, and they've both got expertise in kind of pre-MAP as well as post-MAP as well. Before we go into, and I give you the information about the breakout sessions, I just want to highlight that the Harm Reduction Journal has a special collection on alcohol harm reduction, and we invite anyone who has an interest to submit a paper to the Harm Reduction Journal. And I would just urge that it really be focused on harm reduction and take very much into account looking at some of these kinds of policies and strategies from the harm reduction perspective in terms of preventing harms as a primary goal and priority. So I think if there are any other comments or questions, we have a couple minutes before we go into the breakouts. And I think that Lucy is going to put up the information here shortly in terms of how to get into the breakout sessions. It's through Zoom, and you can choose a link to go with the breakout session that you're most interested in. So Lucy, if you're able to put up that link onto the Socio platform, that would be really great so that people can go into it. And then the plan is we'd have 30 minutes from roughly now to have discussions with each of the hosts. And then we would be able to, we'll come back. And in order to come back, you just come back to the main session. So I'm just hoping that the audience can see the links and that each of our hosts has the links. So I'm going to send the hosts off to the rooms to welcome you. And it looks like the links are there. So thank you very much, Bryn. And the links are in the session description as well, Lucy is telling me. So pick your Zoom link and you will join your host. And we'll see you back here in about 30 minutes. And I see the links have just appeared in the chat as well. Thank you. So see you in a few minutes. Welcome back, everyone, to the main session. It sounds like there are some great discussions going on. And just to kind of bring it together in the last 5 or 7 minutes of the session, I'm going to ask one of the hosts from each of the 3 sessions to just give a 1-minute highlight or 2 of something that was discussed in your session. So it could be a key issue or a highlight that you can share with the whole group. And how about we'll start with Tim. What was a highlight or 2 in your group? I think your mic might not be on, Tim.
Sorry, I was muted. I was just saying the highlight for me, it was the audience. It was the most wonderful. I bet I had the highest quality audience. There was at one point only one person, it was Catherine from Ecuador, who's a lawyer working in New York, and had a lovely conversation with her. And we were joined by someone else halfway through. But I learned, for example, that when prices increased in Ecuador, there was a reduction in crime. And when there were restrictions on drinking on Sundays, people were cross about that. And we get one of these, classic alcohol policy situations of how effective they can be and how people aren't always happy with them. And we talked a bit about some of the international evidence around the interesting, I think, an important fact that pricing policies can reduce health inequalities. And that they are disproportionately, minimum pricing is disproportionately effective for vulnerable and poor people, and that low-income communities experience the biggest reductions in crime and improvements in health outcomes compared with middle income or high income. So anyway, I think the 2 belong together, minimum unit pricing and managed alcohol programs. Thank you, Catherine, for joining my session. I'd have been very lonely otherwise.
Great. Thanks, Tim. Brittany, highlight from your group.
Oh, yeah, we had a small discussion with myself and one other person. Yeah. But I think what Tim was bringing up was kind of coming up in our discussion where we were saying that this policies that are happening in Canada specifically are around that pricing point, and that the group that I work with, Eastside Illicit Drinkers Group for Education, are people who don't really benefit from those pricing options because they've used alcohol for 20 to 50 years of their lives. And so there needs to be options for those people, and that the system is not really well built to support those people. So we need to start thinking about less about how somebody gets into the system and works the system to their benefit, and more about how is the system failing these people.
Great. Thanks, Brittany. That's really brings home the points on inequalities and how the policy doesn't really impact those some of the policies don't intersect well with inequities. Megan or Sybil, can one of you report on a highlight from your group?
Yeah, I love this highlight. So what we actually came to was that MAPS are operating under the radar internationally, at least from the discussion that we had from how a couple people who chimed in. So learning about alcohol harm reduction, that's happening in the same way in Liverpool, Yorkshire, and Ireland in some sites. And we talked a bit about how MAPS happen under the radar. So where communities are providing alcohol to people as an alcohol harm reduction intervention, often in hostels or shelters with wraparound supports. But because of stigma from the broader community and businesses, as well as judgment from governments and assumptions of medical risk, it's often happening under the radar as a pragmatic solution. And so we talked a bit about how in Canada MAPS have often been implemented the same way, but it was great because we had a discussion about, things that communities are doing, I think, in areas that we don't even know on our Canadian Managed Alcohol Program study. So that was the main one, I would say.
That's great. Thanks. Thanks so much, Megan. And it's always exciting to hear what's happening in other countries around MAP because, as you pointed out, it's often happening, but under the radar. I want to thank everyone for coming. And just before we take our leave of you, I'm just going to review, I think, a couple of issues that have come up through some of the comments. And, the first one I think is that this field of alcohol harm reduction is not really well conceptualized or defined. I mean, we can think about it through the lens of our definitions of harm reduction and preventing harms, not necessarily preventing use. But I think we need a more kind of complex and ongoing discussion around the relationship between macro level policies, population harm, and inequities, and where those inequities are, unintended consequences of sort of larger maybe effects around population health outcomes. And so I think the complexity of that relationship between population level policies and reducing harm even as opposed to preventing use, because I think that hasn't been well laid out. And it may be that I'm not an alcohol epidemiologist, so it may be that the alcohol epidemiologists have sorted this all out, but we need to engage in that discussion a bit more. And then, Brittany, as you've highlighted, as well as with the EDGE group, how often the policies focused on population level harm actually can produce harms for people who may be experiencing various inequities in housing or income, or even in types and patterns of drinking, for example. And then we've had lots of ongoing discussions about managed alcohol programs and the role that they play in reducing harms, particularly when people are impacted by structural inequities and can smooth out patterns of drinking and don't necessarily, they can reduce consumption, but they definitely reduce harms. And so I think taken together, we need to continue to have some conversations that better help us to kind of situate and understand what the field of alcohol harm reduction entails and the impact that it can have on population health as well. So thanks to everyone for joining, and a huge shout out to Lucy and Maddie for helping us to host this session. And we look forward to more conversations, more discussions. You can reach out to us. We're all at the Canadian Institute for Substance Use Research, and the session's being recorded, so please feel free to let us know if you'd like to have access to that. So thanks, everyone. Take care and stay safe and have a good day.